and welcome to this week's edition of Tech Roundup with myself, Dr. Laura Bears. And this week we are joined by Alexis, who has recently released a report on neuroprosthetics. Alexis estimates is going to be a market worth $18 billion in 2028. So Alexis, could you talk us through what exactly neuroprosthetics means as an industry and what this covers?
Yeah, sure. So neuroprosthetics is basically an engineered means to restore lost physiological function for which there is no pharmacological cure. Now, what this means is that in certain types of deafness or blindness, the neurons that are responsible for transferring that information about sight and sound to your brain have died off. So there's no real drug that you're going to be able to take that's going to be able to fix this. Now, neuroprosthetics is basically using electrodes to rebuild these pathways. Now, one of the most common examples that we're all pretty familiar with is the cochlear implant. And these work to stimulate some of the remaining nerve cells in the cochlea of the ear. But what you might not know is that these cochlear implants actually served as the springboard for a newer type of technology, the retinal implant. And these similarly work to restore stimulate some of the remaining nerve cells in the retina for people who have had retinal degenerative diseases like retinitis pigmentosa or macular degeneration. And what we're seeing lately is that we have advances in probe microfabrication and biocompatibility, and these are translating over into this new realm of neuroprosthetic limbs. Now, these typically use a sort of bidirectional communication system that not only allows the user volitional control over their prosthetic limb, but it allows them to have some restored sensation of touch. Now, this sensory feedback has been highlighted by some, such as the FNI at Case Western, as particularly important for the performance of more delicate, fine-tuned motor tasks.
Okay, so these bidirectional devices, they seem quite advanced. Is that something that's more in the concept phase, or are we actually seeing such devices in the market?
Yeah, so there are a handful of groups, and some of them are making strides to go to the market. We have in the US, in Utah, for example, Ripple Neuro, they are working on their Mira and Sarah technologies to this end as part of a DARPA haptics project. We also have Case Western. They're working on a similar project, and they have a nice video showing exactly how important this sensory feedback is for the performance of certain tasks. And here you can see with it turned off and turned on, what a difference it makes in our patients successfully removing the stems from these cherries. And then in Switzerland, we have Sensars, their spinoff from EPFL, and they've already tested their Sensi technology in a proof of concept, and they do have future clinical trials planned. What's exciting is that they anticipate achieving FDA and CE certification of their technology around 2021, and the price point of their technology, which they estimate to be around 15,000 CHF or around 15,500 US dollars. So it actually makes it very achievable to acquire and start using in your prosthetics.
So that helps restore functionality to people with, say, lost limbs. But I've seen some interesting things going on recently for people and individuals with degenerative eye diseases. I saw in the news that the US implanted their first bionic eye very recently. So this seems like pretty cutting edge stuff.
Yes. So you can see here in an image from Pixie Vision what retinal degenerative diseases do to our sight. And you can imagine how disheartening it may be to gradually and completely lose your sight over a period of time. Diseases like retinitis pigmentosa affect 1 in every 4,000 people, but other diseases like macular degeneration affect millions of people. And this is projected to rise by the NIH. So for these reasons, retinal implants have been gaining a lot of traction recently. And these are pretty similar to cochlear implants, except that the electrodes are designed to fit into the back of the eye on the retina and lie flat, so they're planar arrays. And they work to stimulate the remaining retinal cells that haven't died off. Now, these similarly come equipped with a processor and a camera that are typically mounted to glasses that are worn by the patient. And I'm very proud of my alma mater, the University of Florida, for performing their first retinal implant with the Argus 2 system. They became the second institution in the state of Florida behind the University of Miami, I believe, that can perform these procedures. We do see other companies too, like Pixie Vision, making important strides. They've revealed recently that they're in discussions with the FDA about beginning a feasibility study with their Prima retinal implant for an indication of age-related macular degeneration.
Okay, so that's bidirectional devices and retinal implants, which seem like very new developments. But what about the more established cochlear implants market? And this is probably something more people have heard of. It's a much more established market, but is there any real innovation going on there?
Yes, actually. So cochlear implants are constantly seeing improvements that make them more durable and user-friendly. Now what we see is we have developments such as improved impact resistance, waterproofing, either with the unit itself or making a waterproof case for it. We see variable wear processors, so they can be worn on other parts of the body beyond the standard behind the ear. And all of these advances are working to enhance the overall quality and functionality of these devices. And here we can see one such example with the Neptune processor by Advanced Bionics. So it's not only a more waterproof or swimmable processor, but it comes with a variety of wearing options for the user, so they could even strap it around their arm to a band if they wanted to. Now, one of the particularly interesting features that we've seen is referred to as virtual channels. Now, the electrodes for these devices typically have anywhere from 16 to 22 channels, meaning that they're only picking up about that many frequency ranges along the length of the cochlea. But what virtual channels do is allow for the simultaneous stimulation by two contacts. So this increases the number of possible unique channels to around 128. Now, this can greatly enhance the user's perception of sound in situations like music. Another thing that we're noticing is entrance into the market of lower cost competitors. So conventionally, cochlear implants have been available from companies like Med-EL, Cochlear, and Advanced Bionics. They're priced about $25,000 to $30,000. Around 2010, we saw a new company, Neurotron, enter the market with their CE-marked venous cochlear implant system at about half that price. And what this does is it makes this technology more easily acceptable to a wider range of patients worldwide.
Great. Well, thank you so much, Alexis, for giving us a fantastic introduction to the wonderful world of neuroprosthetics. If you would like to hear more about neuroprosthetics, please go to IDTechEx.com/webinar to hear and to register for free for an upcoming webinar on neuroprosthetics. Or if you're interested in the full report, go to IDTechEx.com/neuroprosthetics. So that's what you've been working on recently, Alexis. What else is it that you'll be covering at IDTechEx?
So right now I'm working on a report for brain-computer interfaces, brain-machine interfaces, and neurophysiology equipment and supplies. I will be covering this topic at our Medical Innovations Forum USA 2017. This is November 13th, 2017 in the Santa Clara Convention Center. And right now we do have a 20% early bird attendee discount that expires September 22nd. So make sure you sign up for that if you're interested.
Great. And well, that's about all we've got time for this week for Tech Roundup. So to find our full list of reports, please go to idtechex.com/research. We are also now available on podcast at iTunes U, Podbean, and Acast. You can also find us on Twitter at IDTechEx with the hashtag Tech Roundup. Alexis and I are also on Twitter. You can find myself at Laura Bears and Alexis at Alexis Karandrea. Thank you so much for listening. Thank you again to our technology analyst, Alexis, and see you soon.